Hi, my name is Nikki Miller, and I'm a psychiatric nurse practitioner in the amazing town of Ketchikan, Alaska. This presentation is for the Doctor to Nurse Practitioner course, Diversity and Social Issues. For this project, I'll be exploring the Alaska Native population in Ketchikan, Alaska, also known as the salmon capital of the world. Ketchikan is located on the island of Diego and is in southeast Alaska. It is only accessible by boat or plane, which creates unique and challenging situations related to healthcare access, continuity of care, and availability of specialty resources. According to the U.S. Census, Ketchikan has a population of approximately 8,033 people within the city limits and 13,677 within the borough, with approximately 14.9 identifying as Alaska Native alone and an additional 15.1 reporting mixed race. The primary tribal groups in this region include Tlingit, Haida, and Tsimshian. Alaska Native populations experience significant health disparities, including higher rates of chronic diseases, mental health condition, and substance use disorders compared to the general population. These disparities are influenced by a combination of geographical isolation, socioeconomic factors, and the lasting impact of historical trauma. From a cultural perspective, Alaska Native communities often emphasize strong family systems, respect for elders, and a deep connection to the land and traditions. Healing is often viewed holistically, incorporating physical, emotional, and spiritual needs into community well-being. As a psychiatric nurse practitioner, understanding these cultural and systemic factors is especially important when addressing mental health and substance use within these populations. This project focuses on available community resources, as well as identifying gaps in care that impact health outcomes. In the following sections, I will explore 5 key community locations in Ketchikan, highlighting the services they provide, their cultural relevance, and concluding with an analysis of unmet healthcare needs. For Site 1, we will be exploring the Ketchikan Indian Community, or KIC. This plays an important role in promoting culturally appropriate care and strengthening community engagement. Services offered through KIC include primary care, wellness and prevention programs, behavioral and mental health support, and social services that address both physical health and a broader social determinants of health, such as housing, access to food, and family support systems. One of the most important aspects of KIC is the emphasis on culturally grounded care. Services are designed with an understanding of Alaska Native values, including respect for elders, the importance of community relationships, and a holistic view on health that includes physical, emotional, and spiritual well-being. KIC appears to function not only as a healthcare provider, but also as a central hub for community connection and support. This type of environment can help build trust and improve patient engagement, particularly in populations that may have experienced historical trauma or mistrust in the healthcare system. Like many other tribal healthcare organizations, KIC faces limitations related to funding, staffing, and resource availability, not having many of the resources needing to meet inpatient facility requirements or emergency treatment needs. These constraints greatly impact the range of services offered and lead to delay in care or limited access to specialty services. From a clinical perspective, organizations like KIC are essential for reducing health disparities, as they provide care in both accessibility and cultural responsiveness. The role in prevention, early interventions, and community-based support is critical in improving long-term health outcomes within the Alaska Native population. I will be providing links for each of these resources websites in the citation area under the video. For Site 2, we will be exploring Peace Health Ketchikan Medical Center. This is the primary hospital serving this region and essential emergency and acute care services to the entire community, including Alaska Native population. It also serves as the hub hospital for many of the smaller outlying communities in southeast Alaska, making it a critical access point for a large geographical dispersed population. This facility is especially meaningful to me, as it was where I began my medical career and have had many family members who have worked for them throughout the generations. This personal connection has given me a deeper understanding of both the strengths and limitations of care that is provided at Peace Health. Services available at Peace Health include emergency care, inpatient services, diagnostic imaging, and limited surgical procedures. While these services are essential at this hospital, it does not have access to many of the specialty services needed for the community. For example, there is no cardiac catheterization lab available for acute cardiac events or stroke interventions, which significantly impacts the level of care that can be provided locally. As a result, many patients require transfer to higher level facilities for advanced care. Patients are often medevaced to larger hospitals in Anchorage or Seattle for specialty services such as cardiac, oncology, or advanced diagnostics. These transfers can be costly, delayed by weather conditions, and emotionally stressful for the patients and their families. Peace Health functions as a vital healthcare hub. These limitations create significant barriers to timely and comprehensive care. This is particularly impactful for Alaska Native populations and others with limited financial resources or limited support systems. Additionally, hospital-based care models do not always reflect or integrate culturally specific practices, which can influence patients' ability to trust and engage in their treatment plans. From a clinical perspective, particularly in psychiatric care, these barriers can disrupt continuity of care and delay access to healthcare services. While Peace Health is an essential component to healthcare delivery in this region, its limitations highlight the broader challenges of providing adequate care to rural and geographically isolated communities. For Site 3, we will be exploring SEARCH, Southeast Alaska Region Health Consortium. SEARCH is a tribal health organization that provides healthcare services to Alaska Native populations throughout all of Southeast Alaska, including Ketchikan. SEARCH offers a range of services, including primary care, behavioral health, dental services, and preventative care. But what distinguishes this organization is how the care is delivered within a culturally framework rather than simply alongside it. At SEARCH, cultural traditions are not treated as separate from healthcare, but are incorporated into the patient's experience. This can include involving family members in care discussions, recognizing the role of elders in decision-making, and allowing space for traditional perspectives on healing and wellness. There is also an emphasis on communication styles that are respectful and relationship-based, rather than strictly clinical or transactional. This approach can help reduce barriers for patients who may otherwise feel disconnected from the Western healthcare system. Through creating a more welcoming and familiar environment for Alaska Native patients, we can improve comfort levels and willingness to engage in care. In contrast to more traditional healthcare settings, where the focus may be primarily diagnostic and treatment, SEARCH appears to place greater emphasis on building relationships and understanding the patient within their cultural and community context. Despite this strength in culturally integrated care, SEARCH still faces many of the same systemic challenges as across the region, including limited access to specialty services and the need for patients to travel outside of Southeast Alaska for advanced care. From a clinical perspective, particularly in mental health and substance use treatment, this approach is highly impactful. When care is delivered in a way that aligns with the patient's cultural identity and values, it can improve trust, increase participation in treatment, and ultimately lead to better health outcomes. SEARCH provides an example of how healthcare systems can move beyond cultural awareness and begin actively incorporating cultural practice into the everyday treatment of their patients. For Site 4, we will be exploring the Car House, a residential substance abuse treatment program that provides structured care for individuals struggling with substance use disorders in the Ketchikan area. This program serves an important role in addressing addiction, which remains a significant concern for many Alaska Native communities and is often closely linked with historical trauma, socioeconomic challenges, and limited access to ongoing behavioral health services. The Carr House offers a residential treatment environment where individuals can receive consistent support while focusing on recovery. Services typically include structured daily routine, counseling, group therapy, and support for developing coping skills and relapse prevention strategies. One of the key components of residential treatment is the ability to remove individuals from the environment that may be contributing to the substance use, allowing them to focus on recovery in a more stable and supportive setting. The Carr House provides not only clinical treatment, but also a sense of structure, accountability, and community, which are critical elements in early recovery. There's also an increasing recognition of the importance of trauma-informed care in substance use treatment, particularly within the Alaska Native population. Understanding the role of intergenerational trauma and adverse life experiences is essential in providing effective and compassionate care. Despite its obvious needs, access to residential treatment programs like the Carr House remain limited in Ketchikan. Bed availability is often constrained, and there may be lengthy wait periods before admission. Additionally, stigma surrounding substance abuse treatment can prevent individuals from seeking care, particularly in small, close-knit communities. In response to these ongoing needs, there has been efforts within the community to expand treatment capacity, including plans to develop an additional inpatient substance use treatment services out in the Salmon Falls area. This reflects the growing recognition of the demand for more accessible and comprehensive recovery services in this region. Early access to structured treatment programs is critical in improving long-term outcomes. Delay in treatment or lack of access increases the risk of relapse, worsening mental health condition, and other negative health outcomes. The Carr House represents a vital resource in this community, but this also highlights the lack of its ability to support the community as a whole and the continual need to provide more substance use treatment services. For Site 5, we will be exploring Gateway Center for Human Services, which provides behavioral health and social support services for individuals in the Ketchikan community, including the Alaska Native population. Services offered include mental health counseling, case management, crisis support, and programs designed to assist individuals experiencing psychiatric conditions or life stressors. Mental health needs in this region are significant, with many individuals facing challenges related to depression, anxiety, trauma, and substance use. These needs are often compounded by geographical isolation, limited resources, and social determinants of health, such as housing instability and financial stresses. Gateway plays an important role in providing accessibility for community-based mental health services, particularly for those individuals who may not require inpatient care but are still in need for consistent support. Access to these services remains a major challenge. There is a limited number of mental health providers in this region, which leads to high demand, long wait times, and difficulty establishing ongoing care. For some patients, delays in accessing services can result in worsening symptoms and increase risk for crisis situations. Continuity of care can be difficult to maintain, particularly when patients require higher levels of care that are not available locally. This can lead to gaps in treatment and increased strain on both the patients and the providers. Early interventions and consistent access to mental health services are critical in improving patient outcomes. When access is delayed or inconsistent, patients are at greater risk for symptom escalation, hospitalization, or relapse. Gateway Center for Services is an essential resource for behavioral health in Ketchikan, while also highlighting the ongoing need for increased provider availability, expanding services, and improving access to timely mental health care within the community. Alaska Native communities have a strong cultural foundation, deeply rooted in tradition, family, and connection with the land. Despite the strengths, significant healthcare disparities continue to affect this population. Through my exploration of the community resources in Ketchikan, I've identified several unmet needs that impact both access to care and overall health outcomes. One of the most significant gaps is limited access to specialty care. Patients must travel outside the region for services such as cardiology, oncology, and advanced diagnostics, which can delay both diagnosis and treatment. Transportation itself presents another major barrier, as travel by boat or plane is often expensive, time-consuming, and dependent on weather conditions. There's also critical shortages in mental health providers in this region, limiting access to timely care for individuals experiencing psychiatric distress. As a result, patients may experience worsening symptoms or delay in treatment. Substance use disorder remains a significant concern, and although programs such as the Car House provide essential support, access can still be limited by capacity and stigma surrounding treatment. In addition, the lasting impact of historical trauma has contributed to the level of mistrust in healthcare systems, which can influence patient engagement, communication, and adherence to treatment plans. Together, these factors contribute to ongoing health disparities within the Alaska Native population. These findings highlight the importance of delivering care that is truly culturally responsive and grounded in an understanding of Alaska Native values and traditions. Care within this population must go beyond addressing physical symptoms and instead recognize the importance of relationships, community connections, and respect for the cultural identity. Historical and intergenerational trauma continues to influence how individuals interact with healthcare systems, making trust a critical component of effective care. Approaches that acknowledge these experiences while honoring traditional perspectives on healing and wellness can help create a more supportive and meaningful healthcare experiences. Communication that is respectful, relationship-centered, and inclusive of family and community members can further strengthen engagement and improve health outcomes. Cultural strength and resilience are not just characteristics of Alaska Native communities. They are essential foundations that must be actively recognized, respected, and integrated into the way care is delivered. The Alaska Native population in Ketchikan is supported by a range of community resources, yet significant gaps remain, particularly in access to specialized care, mental health services, and reliable transportation. These are not isolated challenges, but ongoing barriers that directly impact health outcomes and quality of life. Addressing these disparities requires more than awareness. It requires intentional actions to improve access, expand services, and ensure that care is delivered in a way that aligns with cultural values and lived experience of these community members. Moving forward, healthcare systems must prioritize not only treatment, but connection, trust, and cultural understanding as a core component of care. By doing so, we can begin to close the gap and move towards a system that is more equitable, more effective, and more responsive to the needs of the Alaska Native population.